Well, look, I'd like to speak with you about the environmental scan, what it is, and in particular, the lead up to production of the next scan, which is due in February next year. Now, for those of you who aren't aware, the environmental scan is a product that we produce on an annual basis, and is part of our role as a training package developer, in that each year we conduct the scan, which is an analysis of issues of supply and demand in our industries with a focus on skills and the workforce. And the information it produces ensures that we've got the information we need to ensure the training packages are current in terms of being a reflection of the issues in the industry. So the scan we're about to produce is the fifth one. It's the fifth year that we've been producing it. And what we've found is that over and above the training packages process, the actually doing the scan is an excellent opportunity to collect and use a lot of information about the industry that's far broader than the training packages process. So particularly with an emergent workforce development agenda, the information we're collecting in the scan is really quite important. And we're certainly looking at increasingly using the scan as a more formal part of our business planning process at the Skills Council. And look, information we've received from stakeholders is that it's a very useful planning tool for organisations in our industry. So we'd like to make it a critically more important document for that process. Now, I'll just get the zapper going. There we go. Now, in terms of what's in it, and look, its use as a planning tool, what we've got here is the key messages that have emerged in the scan and published in 2011. These messages, they have actually emerged right over the last 4 years, in fact. The issues in our industry don't magically change from year to year, and there are trends that have been continuing for some time. Now, if I can just step through these key messages in the 2011 scan, look, it is important, again, because we fully expect that these will be the key messages that will still be in place for the 2012 scan. But again, we will certainly look at what's changed in 2011 and again have a look at how we can sharpen up these messages for better workforce planning and for better planning in our organisations. So the first message is that there has been significant growth in our industries, and we now have 1.3 million workers. That's been going on for a couple of decades, and the trend is that this is going to continue. The second message, and I think this is perhaps the most important message out of the scan, is that we're seeing a focus on policy and services that are about maintaining client functional independence in community settings and also meeting increasingly complex needs of clients in community settings. So as we're seeing in the aged care area with the Productivity Commission report, we're seeing the consumer is far more the focus of policy and services. Consumers are going to be more demanding around the services they want. We're going to see an environment where consumers are drawing on their own capital for the provision of aged care services, where we're going to see the consumer wanting to actually drive how, where and when they want their services. In the disability sector, even more so, with a focus on individual funding via the insurance scheme. And with a focus on moving from the illness-focused health model that has, I think, dominated services, we are moving to more wellness-focused models. So again, this is about, I think these are really important parts of client-centeredness and person-centeredness, and I think they're the major strategic sort of drivers that are going to be pushing the way we drive new job roles, new skills, but also driving policymakers in terms of the design of services and funding those. So again, I think this is probably the most important message that's emerged out of the scan. The next two relate to the community services and health industries. The community services industry needs to expand its capacity, and we are seeing the community services industry and the not-for-profit sector in particular increasingly relied on as being the service provider and service deliverer. And in a range of sectors, community services have been underfunded, under-coordinated. We have low wages, a whole range of things that I think policy has recognised and recognises that these things need to change, and they are changing. But again, this is a major context for the industries as a whole. In health, we're seeing reforms through health reform nationally, with some of the major focuses on change in health as being a focus on interdisciplinary practice, services that are delivered in non-hospital settings, person-centred approaches in health, a focus on new roles, certainly a focus on leadership and management, and we've seen Health Workforce Australia increase its operations in a range of these areas as well. Some of these changes and directions are again consistent with our further message that services are focusing on more on client independence and delivery in community settings. So that's a big change affecting the health industry. The next two messages coming out of the scan relate to the education sector and policy around workforce itself. In relation to the education sector, we do need to see improvements in quality in the vocational education and training sector. I think it's positive that we've now moved to national regulatory arrangements for vocational education and training. That's going to be an opportunity. But as our workforce grows and there's increasing reliance on what we do call the VET sector of the workforce, the education and training of workers who are increasingly working at higher levels in aged care, disability and other levels, it's critical that the consistency and quality of skills and therefore service delivery is maintained and supported through education and training. So we do have some work to do there on getting to a better level of consistency and quality. We're also seeing reforms in the higher education sector with moves to demand-driven student places in higher education and the formation of a new regulator as well. And there is going to be a move towards a unified tertiary sector regulator sometime down the track. 2013 is the date, but as to whether or not that's achieved, we'll just have to see. So both of those sets of reforms in VET and education and collectively are important for our industries because our workforce draws on both of those education sectors significantly for the supply of the workforce. But also the separation of those sectors as well has actually proliferated a separation in workplaces of, well, that's higher education and that's VET, when we do actually need to see more integrated roles and functions being developed. And the final message out of the scan is that there is a workforce development agenda emerging, which has been certainly led by Skills Australia with its release of Australian Workforce Futures last year and some subsequent work. And look, this agenda is really moving us on from what's been a training to a skills and now workforce agenda. And one of the things that Skills Australia has led is that we need to focus more on the utilisation of skills rather than the delivery of qualifications and the delivery of skills. So just to focus on the delivery of qualifications hasn't been having a broad enough impact on productivity. We do need to look more broadly at recruitment and retention, at job design, at innovation, and probably most importantly, leadership, particularly when we're seeing such a reform environment in community services and health. So look, I just wanted to spend a bit of time on those messages because they are significant. They're not really changing, but as we produce the scan on an annual basis, we want to really focus on these and see how we can improve them in terms of clarity and of making the scan better use as a planning tool. Look, I'll just cover some of the quantitative data about the industry and the workforce, and then just go through a bit of a catalogue of some of the trends that have been changing in 2011, and then actually have a look at some of the implementation data around our qualifications, and then just wrap up with some of the questions we'll be looking at to produce the 2012 scan. Look, this chart just shows the 1.3 million workers. We took a cut of the 2011 August figure from the labour force survey, but we can see that our industries have been growing significantly, and 8.6% growth rate in 2010 was just absolutely enormous. And I often say that we thought 5.8% growth rate in 2009 was significant against the downward trend of the global financial crisis. So our industries are really growing fast. We published these figures, which breaks that 1.3 million workers down across states and territories, and you can see some really significant percentage growth rates in the ACT 20% and New South Wales 12%, and all states and territories certainly well above the all-industry growth rate of 3.3. So community services and health in some ways is immune to some of the global trends that are affecting industries like manufacturing and retail spending and growth in resources. So we can expect to see a continued growth trajectory. Some figures that we're going to explore a little more in the next environmental scan are breaking that 1.3 million down across the higher education sector and the vocational sector. So what we've got here is that in the health industry, we'd say that forms about 60% of the combined health and community services, but of those 780,000 workers, about half are health professionals, doctors, nurses, allied health professionals, and about the other half are workers who may have a vocational qualification or may work in a role that would require a vocational qualification. And in the community services industry, there's a greater proportion of people who would rely on vocationally oriented roles. We like to emphasise this because it shows in the health industry, for example, there are large numbers of workers in the vocational sector, an equal amount to those in the health industry, and so we should have an equal focus in policy and investment on the development of this workforce. So we are seeing large investment in health coming out of the Health Workforce Report of the Productivity Commission and the establishment of Health Workforce Australia, focusing on initially supply of the profession's critical issues like clinical placements, but we really need to keep an eye on these figures and ensure that we're investing equally in the rest of the workforce too. Here's a chart that looks at the growth in the next 5 years, and you can see that health and community services needs 322,000 workers, and the next closest industry sector is construction with 195,000. So that means our industries will supply 25% of the new workforce in the next 5 years, and itself grow by 25% too. So, look, we really need to get this right. We hear from government and government policy that structural adjustment is really important. For example, with the downturn in manufacturing because of high terms of trade, we're seeing displacement of those workers to other industries. I mean, what does this mean for community services and health? Well, we are growing, but I think the things that we need to get or the issues right are some of our own internal structural adjustment, really realising the new disability sector, the reforms in aged care, getting the new roles that cut across our traditional sectoral silos and focus on community settings and so on. I think they're the message that we really want to be getting across in the context of the whole economy. Of those 323,000 roles that we need to grow, again here we apply the same sort of figures, and again we'll need to draw significantly on the vocational and the higher education sectors. Some of the fastest growing occupations we can see here, again along this same theme. We do need 50,000 registered nurses in the next 5 years, but we need, almost 60,000 from the classifications of aged and disabled carer, a nursing support and personal care worker. Now, I'll just move through reasonably quickly some of these trends that we're seeing, some of the changes we've been seeing in 2011 around some of the existing trends, and these are some of the things we'll be looking at in influencing the new scan. So, in disability, a national disability insurance scheme, we heard about that today, and I thought that table of the then and now really was a good example of how services and work roles will need to be organised. So from the charitable to the new rights-based approach, for example, from a service or care approach to a true support and empowerment approach. We've seen the equal remuneration case for community services workers come in favour of the application. Government's now considering how funding can actually support that decision. In aged care, again, I think we've talked a lot about this, but the Productivity Commission sets the roadmap here with some key recommendations about pricing skill mix and training quality in particular. Oops, I've just gone backwards there. In the health industry, again, a range of reforms happening. Health Workforce Australia ramping up. Their work plan, or their updated work plan for 11-12 has just been released in September. We've just seen a very informative presentation around Medicare locals, and I think a message we got there is a key priority, although the biggest challenge is collaboration for the Medicare locals, and that's a message we tried to get in the last scan, which is these organisations have to move on from just being divisions of general practice to being organisations more focused on integrated health and community services. The not-for-profit sector Reform Council has been established and is looking at a range of areas, and I've just pulled down a few of their current working groups from their website. Again, I think this group or workforce will be important or it'll be important for us to engage this group in the workforce questions going ahead. We've talked a lot about children's services and the new regulations and needing to meet those. So workforce development, training quality will need to play a big part there. The National Care Strategy has been released by Doha, and certainly tracking how carers play a role in the delivery of services is going to be crucial going ahead. And look, we've discussed the consumer and person-centred focus that is again at the heart of a lot of these changes, and is going to be a big challenge that policy is going to need to address going ahead. In mental health, we've seen large investment, and there's a new national mental health workforce strategy and plan coming out, and we think some of the challenges that we've articulated here is a more integrated mental health sector, from biomedical to social rehab. Further trends, changes in the VET sector. NQC has been replaced. Again, we've got the new national regulator, and the new National Workforce Development Fund will be moving to a new National Workforce Development Agency. Without going into the nuts and bolts, the nomenclature is quite clear here, moving from a skills to a workforce-focused agenda. We've spoken a bit about higher education changes. Skills Australia is doing some new research on forecasting workforce needs in the economy, and I've just called that Workforce Futures 2. I don't know what it'll be called, but it's coming soon. I think it might be about 6 months. And look, one of the significant changes here is this Workforce Development Fund and the $25 million that's been made available to aged care. Jenny Ferber spoke to us about some of the details in this, but again, without going into the nuts and bolts, is that we need to see this funding used for broader workforce development. Again, so we're working with the unions and the employers, looking at trying to bring DWAR and DOHA together to look at things like leadership, workforce advisory services, not just training places. So I think this is a good start, and we'd like to see how we can move this into other sectors too. Training quality has been, again, raised and discussed. It's a particular issue in aged care and children's services. And we've been having some conversations with the national regulator, with the DOHA, the key funding body. We've been talking internally in the Skills Council about some of the things we need to do here, such as mandating workplace assessment requirements in competency standards. That's one lever that we've got to pull to make some improvements here. So there are, again, a couple of things that are happening, but are really quite crucial to the trends we're looking at. In terms of use of the qualifications, we can see this chart. There were 237,000 enrolments recorded in 2010, the latest NCVER data, up from 200,000. So use of the qualifications is quite significant. Although the growth is good, the investment is good, we do still have quality problems that need to be addressed, and in children's services and aged care in particular, would you believe, of which record the highest numbers of qualifications. Again, although there are issues, it is good to see this growth in investment. In the health training package, again, we can see enrolled nursing and the general health services area, which includes allied health assisting, health service assistance as some of the major areas. They're the top enrolment level qualifications. Look, one final point to leave about the existing eScan. An important part of it is the scan articulates some workforce development challenges. They're listed here, but as the shift in service models, leadership, complexity of client needs, new roles, in particular assistant and advanced practitioner roles, integration, capacity in community services, labour shortages in rural and remote areas, and technology. I think it's these challenges are things that we want to focus on in terms of developing solutions and responses, and so we'll be looking at these a bit further as we develop 2012. So look, this slide just summarises some of that. The industry and education sectors. Here's a whole range of trends that have been relevant over the last number of years, but what we want to do is see, well, what's happened in 2011 and how can we reflect that in 2012. We want to focus on the workforce development challenges, and so really the key questions we'll be asking for production of the next scan is what's influencing change in 2011, and what are the implications for design and supply of the workforce. So they'll be the key questions we're asking, and look, just for your information, we'll be inviting submissions over November for eScan 2012 and have a survey available, and we'll be doing some interviews with key people, so we'll certainly be inviting input then.